Thank you for being here today. I know as I look out across this room, there's not a single one of you who has not been touched by cancer, whether personally, through a family member, or a friend. It is important that we remember each individual. I feel compelled to think about this in a bigger way, which is why I work at the National Cancer Institute. We've worked hard on this in the US, and the news is relatively good. We know there is still more to do. We've made progress through prevention, screening, and treatment. We've reduced the rate of cancer and improved survival through focused programs. Since 1991, the cancer death rate in the US has fallen 26%. Still, in 2015, nearly 590,000 people in the US died of cancer, and globally, 8.8 million people died of cancer just in 2015. In low and middle income countries, we're seeing a rise in cancer incidence and deaths. The good news is, in these countries, they've made progress in infectious diseases. The sobering news is that while these systems are in place to deal with infectious diseases, systems to address other diseases like cancer have not received the same time and attention. A woman in her 30s may receive antiretroviral therapy for her HIV infection, which could prolong her life by decades. But she may develop cervical cancer that goes undetected and die within the year, robbing her community, her economy, and her family of the productive life she could have lived. Governments in the African, Asia-Pacific, and Caribbean regions where we are working are facing a budgeting crisis they did not plan for. Their already stressed health systems have not focused on cancer. Putting out the fire year after year in infectious diseases has not allowed the time and attention to be directed towards cancer. We know in these countries there are planning experts and policy experts in infectious diseases. There are on-the-ground clinicians, researchers, and advocates who are doing the best they can in cancer. How to ignite this community? We provided a platform and dedicated time for these individuals to focus on cancer. We took the ECHO model to a new level to multiply its impact in country. In our African Cancer Research and Control ECHO, one of the participants, Anne Nganya from the Kenyan Ministry of Health said, "I almost didn't join ECHO 2018 simply because I wasn't sure how ECHO was different than a typical webinar-based training program." We wanted to show Anne and all the other participants how ECHO was so much more than a webinar, how the possibilities were limitless when bringing together in-country networks. One of the first conversations we have when engaging a country who seeks our support is about the team. We know that team building is important, and our in-country partners know it's important as well. However, team building is often one of the last aspects addressed because of the time that it takes. I often quote the African proverb, "If you want to go fast, go alone. If you want to go far, go together." It's amazing what happens when you bring together people who have never worked together before. They begin to see each other's perspectives, and this enhances the results. So we started meeting in person, and our forums grew. We started with 3-day in-person leadership forums, and this overcame a one-by-one country approach and also helped us begin to build regional networks. But we knew that a 3-day forum with a few follow-up phone calls was not sufficient. We wanted to be efficient, and we wanted regular, sustainable engagements with our partners. So what to do? We wanted to find cost-effective ways to maintain relationships. We wanted to be efficient. For us, the ECHO model was the answer. We started in the Caribbean, a group of islands that cover a large geographical distance, that share similar problems, and that wanted solutions in their communities. They wanted to focus on breast and cervical cancer. They wanted to engage ministry, research, and other organizations. We helped build platforms and provide network support that remain today. In the Asia-Pacific region, countries and islands that cover an even greater geographic distance than the Caribbean, we proposed to continue our in-person cervical cancer work using the ECHO model. We wanted to bring together regional experts, and that's exactly what we did. In Africa, we had 48 participants from 12 different countries sign up for our ECHO. These were people beyond the health sector. These were political leaders and decision makers, because we knew without political will, this would not happen. The results we're seeing are amazing. One participant from the Asia-Pacific region told us, "We've recently passed the Radiation Safety and Control Bill in Parliament, which we see as a first step towards treating cancer with radiation in our country. This is a huge step forward for this island nation, and this is a direct result of the ECHO project." In Africa, the participants noted one of their favorite parts was the engagement with their regional colleagues and learning that way. They also liked access to global cancer policy experts. One participant told us he met a WHO expert and was able to immediately connect, having already formed that relationship on ECHO. And the face recognition on Zoom really helped as well. We're seeing amazing results in Africa, but the best was yet to come, because the local leaders are taking the reins. Remember Anne, who was skeptical about the ECHO at first? She is now a champion. She is leading the African Steering Committee to continue the ECHO work in 12 countries. Here is what Anne had to say after ECHO. "We built networks in cancer control and networks beyond this space. And because of this, we are now providing financing for our Kenyan cancer control strategy." Anne went from skeptic to champion. She is on the case, leading the charge. We share the ECHO goal to reach 1 billion people and prevent cancer and improve outcomes and survivorship. There's been nothing more rewarding than seeing the local leaders grab the reins. We know health experts and government officials will always face fires to put out: Ebola, flu outbreaks, and others. But we know that the focus on cancer control will lead to prevention of cancer and improvement of the health system overall. Our goal is to continue to ignite the cancer community so that where you are born will not determine if you have access to cancer services. Thank you.